There's another question that we've got here, kind of shifting a little bit, that I think is great. Asking really about, the question is about EMDR therapy and kind of what is EMDR, how does it work, how does it help with trauma? There's a lot of kind of folks asking or having heard about EMDR and not really being familiar with what it is or what it means. They've just heard, hey, it helps with trauma, that they've read or heard from someone that it's evidence-based, that there's reporting around it. So maybe we're going to spend just a minute kind of talking a little bit on the clinical side of defining some things. And if you've heard about EMDR or trauma-informed approaches to doing therapy and have been curious about what that means, we're going to take a few minutes here to dive into that. And so we want to think about kind of trauma-informed approaches as a larger umbrella for approaches to doing therapy. And they're all kind of coming out of research around how traumatic events impact the brain. They change the brain, change the body, and looking at allowing that information to inform how we go about treatment and helping folks heal from traumatic events. And they have some common ground between them. They have some differences between them. And so maybe, Tish, if you want to take a minute and talk a little bit about what is EMDR, how does it like or different from like an ADP or other kinds of therapy that might be used to kind of work around traumatic experiences that people have had in their life.
Yes, I'm so glad someone asked about trauma. To understand kind of about EMDR, it's helpful to understand a little bit about trauma. And so how trauma works in the brain and in the body. And so just really like simply put, a traumatic event is anything that your body physiologically experiences as traumatic. And so it's important to just note that that there are like the big T traumas that everybody thinks of that are like life-threatening, you know, having a crime committed against you, a car accident, something of that nature. But then there's all kinds of situations that we're in that our body responds with overwhelmed with stress, overwhelmed with fear, and our body codes and understands that as trauma. And so anything that we physiologically experience as trauma is traumatic for our body. And so because trauma is so embodied, it's very important to have an approach that treats it, that is going to address how the trauma is stored inside the body. So whenever we have a normal memory or event that happens, that is integrated into long-term memory. And so it's very clear, it's processed through our brain, it's time-stamped, and it's integrated into long-term memory. And we can clearly know that thing happened in the past. But whenever something is traumatic and our brain and our body is flooded with stress chemicals, it's a very different process that event is filtered through inside of our bodies. And so that event is not time stamped, and it's too overwhelming for the brain to be able to store that as a coherent narrative. So the brain fragments it. So the images are separated from the body sensations, separated from the emotions. And if you imagine like puzzle pieces getting put in a box, that is stored in the brain and is open to be triggered and brought into the present by certain things in your current environment that might be coded very similar to the brain as that thing. So that's just a really quick kind of summary of kind of how trauma is embodied. Is that clear, Josh? Is there anything that you want to add to that?
No, definitely. That kind of captures just in a paragraph, kind of understanding what does it mean when something's traumatic, right? And I appreciate the helping folks understand that there's while we think about big T trauma in the sense of the examples life-threatening or fearful, painful, scary kind of situations that are big. But that's not the only kind of traumatic experience that we have, and that trauma can be cumulative in nature, and that it really affects the way the body processes and stores that information. And so it doesn't really matter what the event is. It's really more about how the individual experiences that event and what the body does with that event that then defines it as trauma. And this influences how we go about treating and helping folks find healing around traumatic experiences that they've had in their life.
Yes, absolutely. So to say a little bit about EMDR, EMDR was developed by Francine Shapira, and it stands for Eye Movement Desensitization Reprocessing, which it is a mouthful. And she actually says now that she wishes she could rename it, because at the time of developing it, she discovered that eye movement back and forth seemed to aid in being able to process, stay with, and process to completion difficult or overwhelming emotional and memory content. And so now they found that what was aiding in that is actually bilateral stimulation, which is where both sides of the brain are being stimulated at the same time. And that can work many different ways. Tapping, a lot of EMDR therapists use buzzies or audio. And so the goal of EMDR is to be able to desensitize the trauma, which blocks the being able to process and resolve the trauma. So that is why you can think of trauma as being stuck in your body. And it's stuck in your body because every time the brain tries to process it, it gets overwhelmed and it goes into compartmentalization, suppression strategies. And so EMDR and the bilateral stimulation helps the nervous system of the body stay calm enough to be able to stay with the overwhelming, distressing content long enough for it to be desensitized. And then as soon as it's desensitized and the brain can stay with it, our brains do what God created our brains to do, and it begins to problem solve. And it's like all of a sudden that trauma, all of the resources of truth, all of the adaptive kind of ability of our brain, all of a sudden those resources are available to that trauma when before it was blocked. So EMDR is very effective in being able to desensitize trauma and to be able to take a traumatic memory that feels like this, totally overwhelming, and to shrink it down and help it become much more manageable. And so okay, I'm trying to think. I have a lot of thoughts in my mind.
There's so many things to say about that. They're like, okay, so where do we go from there? That's a good kind of summary kind of piece of what EMDR is and kind of understanding how it works and the mechanics of it. I think one of the helpful pieces that starting with an understanding of trauma and then talking about how EMDR accomplishes that is really helpful in helping folks understand that EMDR as a model isn't the only mechanism, the only model that does those same things. That it's a set of structures and techniques that comes at addressing the physiological components that are a part of trauma, and this is how EMDR does that. But that bilateral stimulation and the other components that make that methodology effective are achieved through different routes with different models, and that different trauma-informed kind of approaches to doing therapy that allow that same neuroscience to influence how it is that they approach things. So I think it would be maybe helpful a little bit, because we get a lot of times we'll get phone calls to the office and folks will say, hey, we want to work with somebody that does EMDR therapy because I heard somewhere, read somewhere that EMDR would be helpful in my situation. And typically those phone calls are coming from individuals that don't really know what EMDR is or how it works or why it's effective. They've just heard from someone or somewhere that it is effective. And so they're asking for an EMDR therapist, which we have folks on the team that are trained in EMDR. that can work from that model. But it's actually probably not our go-to model that we use in working around trauma, because we've found some other models that work, we think, probably better and work better with other aspects of wholeness that we're wanting to help folks through. So I'm wondering, Tish, could you take maybe a minute and compare like EMDR as a model and approach to say AEDP, talk a little bit about what AEDP is and how that model and approach kind of addresses and speaks to the same neuroscience realities that help EMDR be effective.
Yes, absolutely. And I think, and there is some disagreement on this, but I kind of look at EMDR as an intervention and not as a model, because I think that it doesn't address a lot of the aspects holistically of trauma, because even though it addresses the actual event, you experience the event and have been re-experiencing the event for however long that's been with you. And that has shaped how you relate to the world and how you relate to yourself and how you relate to others. And so it's really important for trauma to truly be resolved and healing to be accomplished, that it's approached holistically. And so we at MyCounselor, we really use experiential therapy. And so we use AEDP, which is accelerated experiential dynamic psychotherapy. Right? Did I get it right?
Yeah, these acronyms are killer, aren't they? Accelerated experiential dynamic psychotherapy, AEDP.
Yes. Okay. I'm like, did I hit every letter? And so AEDP, how God created our brain, is that how trauma is stored in our brain, it isn't a life sentence. And so the part that brings suffering with trauma is that it isn't in the past, it's very much in the present, available to be triggered and with us all of the sudden. If we're suppressing it, it's coming out sideways in different areas of life. But why that also is beneficial for healing is that we have access to it. And that whenever the trauma is triggered in our brain, that means it's open for editing. And a way that our brains are designed to be able to edit traumatic material is through experience and through imagery. And so experiential therapies really use the present moment experience of being with a trusted therapist that you know well, that knows you well, that there is a relationship there, taking you through experiences of interacting with the different pieces of your trauma in different ways. Is that too vague, Josh?
No, I think that's good. And I think it does create question marks for folks who are like, okay, what does that mean? And what does that look like? And we definitely don't have time and space here to kind of do a graduate level dissection of the model and kind of talk through it. I think I would recommend folks out to the book, It's Not Always Depression, if you have curiosity about that model or approach, because that would be a great kind of overview and give you some insight into the mechanics of it and a picture of what that looks like, and maybe a picture of what you might experience. And there it is. There's the paperback copy. You can get it on Kindle or audiobook also. But it would give you a good kind of introduction to what that model or approach to therapy looks like when it's engaged in counseling. And of course, MyCounselor, we approach that from a biblically integrated perspective. And so the scriptures are the foundation from which we build that model off of and operate from that model with. But one further kind of piece that I think would maybe be helpful would just be helping folks kind of think about how to think about EMDR versus kind of other approaches. So it's like, okay, so if EMDR is a set of kind of interventions, or it's a particular way of trying to go about that approach, how does AEDP as a model kind of accomplish those same sorts of things, or how does that engage that? Any pieces that you would share around that or come to mind around that?
So
I think about specifically
yeah.
the bilateral piece, and that, you know, that one of the dynamics that, you know, upon further research, that kind of understood about the mechanics in EMDR and what's helpful is the bilateral stimulation. And there's within the research that's been done with ADP and other studies, just in neuroscience, is understanding that bilateral stimulation can be accomplished in different ways. That doesn't have to necessarily happen with a sensory body sensation in order to move between the two, but through an interaction between the kind of the more cognitive components of material and the emotive components of material, create a exchange of information and interaction between those different components of the brain that is able to allow the processing of traumatic experience as well, without the eye movement components to it or kind of buzzer components to it.
Yes, I mean, you said that so well. And so it, you know, kind of going back to the puzzle pieces of the fragmenting trauma creates of body sensation from the cognitions or thoughts, from the feelings, that that the goal is to bring those together for a coherent narrative. And so whenever you're processing trauma, the most important piece is that all of those things are coming together. The body sensation of what your body experienced in that moment, with the emotions you felt in that moment, with the thoughts that you were having in that moment, with the images stored in your brain about that moment. And so being able to, our brain really likes when we have cognitive awareness of our experience, and it feels very distressed when there's dissonance there or disconnection there, and trauma automatically brings fragmentation and disconnection. And so being able to bridge the gap of being able to bring cognitive awareness and understanding to your body sensation or emotional experience, right? Our emotions are in our body, they're embodied. And so as we do that, that is creating that bilateral stimulation, or is creating that those fragmented pieces to come together so that a coherent narrative can be built. And so then that is the process of that traumatic memory being integrated into long-term memory and being resolved. Yeah.
That's about as much depth into, you know, how to conceptualize trauma and how different models come about addressing trauma. Hopefully too many folks didn't kind of like gloss over.
I know.
We got into the weeds a little bit there.
Sorry.
But I think it's helpful with a common question that we get from folks that'll call in and they'll ask about EMDR because they've heard about that someplace. And so there's a good 10-minute synopsis on trauma, EMDR, and approaches to kind of treating trauma.